Welcome to Crack Surgery YouTube channel. In this video we are going to study blood transfusion, blood components. Its contents, indications, contraindications. Before proceeding, please subscribe to my channel. Blood transfusion is the process of transferring blood products intravenously into the human circulatory system. Blood transfusions are used in various conditions to replace lost blood components. First, whole blood. It contains all RBCs, WBCs, platelets and plasma. Whole blood can be used in acute massive hemorrhage and during open heart surgery. Second, RBC transfusion. It contains RBC, leukocytes, in variable amount, small amount of plasma. Each unit of packed RBCs will raise count by 1 gram per deciliter and hematocrit count by 3%. It is indicated in anemia. Chemotherapy, hemorrhagic shock. It is contraindicated in allergy, anaphylaxis, infections, trolley, transfusion-related acute lung injury, ECF, volume overload, HIV, hepatitis B, hepatitis C, and CMV. Third, platelet transfusion. It contains platelets. It is indicated in bleeding due to thrombocytopenia, thrombasthenia, which is chemotherapy-related. It increases platelets count by 5,000 to 10,000 per microliters. It contraindicated in allergy, anaphylaxis, infections, trolley, transfusion-related acute lung injury. FFP, that is fresh frozen plasma, frozen solid at -18 degrees C or colder. 0 degrees Fahrenheit within 8 hours. It contains plasma protein, coagulation factor, protein C and S, and antithrombin. It is indicated in low levels of blood proteins, coagulation factor and others, for example immunoglobulins. Also used in replacement of coagulation factors in cases of factor deficiency, for example hemophilia. It acts as an antidote to the warfarin toxicity. It can be used in ATIII deficiency, that is antithrombin deficiency. It can be used in the treatment of TTP, that is thrombotic thrombocytopenic purpura. Also used in replacement of immunoglobulins in cases of immunodeficiencies. FFP contraindicated in allergy, TACO, transfusion-associated circulatory overload. Trolley, transfusion-related acute lung injury. Note: do not use FFP as a volume expander. Use saline instead. Crystalloids or colloids, cryoprecipitate. It contains fibrinogen, von Willebrand factor, Factor 8 and Factor 13. It is indicated in hemophilia VWD, von Willebrand disease, hypofibrinogenemia or a fibrinogenemia DIC, disseminated intravascular coagulation, also used in reversal of excessive anticoagulant administration, contraindicated in TTP, thrombotic thrombocytopenic purpura. Thank you for listening. Please subscribe to my channel to motivate me to study. Thank you. Have a good day.